as a nation, are in an opioid epidemic. I think we're all well aware of that. Over the last 2 decades, we've seen a significant uptick in the rates of opioid misuse and abuse, unfortunately leading to unintentional death in some members of the community. As physicians, we are not immune to the negative impacts of opioids. And in fact, we may be contributing in that we prescribe opioids to our patients. We do this with the best of intentions, hoping to control pain. And as a surgeon, my goal would be to control pain in the postoperative setting most commonly. Hi, my name is Matthew Ziegelman. I am an assistant professor at Mayo Clinic in the Department of Urology. And I'd like to take a few minutes to discuss our article that will be published in the upcoming May 2021 issue of Mayo Clinic Proceedings. The title of the article is Prescribing After Implementation Using Standardized Postoperative Opioid Prescribing Guidelines, an Interrupted Time Series Analysis. So I think it's important to first consider why this topic is important. Unfortunately, there is literature that suggests that a certain percentage of patients who have never been exposed to opioids and who receive an opioid prescription after surgery may go on to develop misuse, abuse, or even overdose and death as a result of the opioids that they were initially prescribed after surgery. The other concern is that these opioids could be diverted, meaning that they were prescribed to one person, but end up being taken or misused by someone else. And so with this background, as a field, we are looking for ways to optimize postoperative pain control while minimizing the use of narcotics. And we at Mayo Clinic have I think been at the forefront in really pushing the envelope in how we prescribe opioids and how we optimize our outcomes in this setting. So several years ago, we convened an opioid task force at Mayo Clinic, specifically within the Department of Urology. And this task force included members of the urology department. It included experts in pharmacy. It included experts in our nursing care and experts in healthcare delivery research. And the goal here was that we would evaluate our own prescribing practices at the Mayo Clinic campuses in Rochester, Minnesota, Scottsdale, Arizona, and Jacksonville, Florida. And we took that historical prescribing data and we used it to create a series of tiers where we put certain surgical procedures into tiers. And we made recommendations as far as what seemed appropriate for the amount of opioid medications that should be prescribed in conjunction with other forms of pain control. So we took our guideline and implemented it into practice in January of 2018. And that's really where this paper came into play. We wanted to see over the subsequent year and a half or so how our prescribing practices changed over time. So we looked at a time frame both before and then after implementation of this guideline, which was distributed to our clinical providers, to our nursing staff, to our clinic staff, to our operating room staff. We looked at how our opioid prescribing practices changed. And what we saw was pretty impressive. The median number of opioids that we prescribed decreased from 150 oral morphine equivalents prior to guideline implementation to 0 oral morphine equivalents after the guideline was introduced. We saw that over 90% of patients who were prescribed an opioid were prescribed that medication within our guideline parameters. And despite this, we did not see any significant uptick in the number of patients calling back in and requesting a refill for their medication. Specifically, this guideline encompassed 21 different procedures. And for the vast majority of those procedures, we saw a significant decline in prescribing, suggesting that we are doing a good job of utilizing our historical prescribing data and expert opinion to really make meaningful changes for our clinical practice. Now, there are certainly opportunities for improvement here, One thing about this paper is that we didn't look at patient utilization. So this was prescribing practices for clinicians, showing that, yes, we can make a difference. We can change prescribing practices. But what we need to do next is understand how many opioids are patients taking at home? What are the optimal number of pills that a patient needs after a specific surgical procedure? And what can we do to encourage patients to use alternative forms of pain control? And so we are looking forward to continuing this research and continuing to make a meaningful difference for our patients' lives.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.